Today we're going to study a very important topic, which is actually diarrhea. So let's start it. Bismillahirrahmanirrahim. Okay, so basically diarrhea is increase in the stool weight when it is greater than 250 gram per day, accompanied by increased frequency and liquidity of the stool is called diarrhea. Diarrhea is basically when a patient actually passes 3 loose stools or more than 3 loose stools in a day, and the amount is greater than 250 and consider diarrhea as compared to normally a normal person passes. It is basically in diarrhea there is increased frequency and liquidity, means the stool consistency is liquid. It is watery consistency of the stool. In this definition, it tells you about the amount, it tells you about the frequency, and it also tells you that what is the consistency. Okay, moving towards it, then it is divided in acute and chronic on the basis of their onset. Diarrhea lasting less than 2 weeks, when it is actually less than 2 weeks, is called acute diarrhea. Okay, now what are the causes of acute diarrhea? Emotional stress, food intolerance. Some people doesn't suit many foods actually. That's also organic substances like mushrooms, shellfish, drugs, and infectious agents including virus, bacteria, and protozoa. Means stress, food intolerance, organic substance, and you have drugs and infectious agents. Many of the many drugs when patient takes, so it causes diarrhea, like people who take iron tablets, that suffers from actually diarrhea, loose stools. Chronic diarrhea, when it lasts for more than 2 weeks, it is called chronic. It is divided into 6 categories. One is osmotic, secretory, inflammatory, malabsorptive. Okay, chronic infectious and motility disorder diarrhea. Now moving towards acute infectious diarrhea, which is gastroenteritis. It is divided into 2 forms: inflammatory and non-inflammatory diarrhea. Inflammatory diarrhea basically suggests that it involves large intestine by invasive bacteria or parasite, means the bacteria and parasite or either toxins which are released by the bacteria or parasites basically cause this diarrhea. And clinically, the patient has frequent bloody stools, small volume stools, often associated with fever, abdominal cramps, and tenesmus and fecal urgency. The patient will complain of the fever, abdominal pain, cramps, small volume stools, bloody stools. Okay, in non-inflammatory diarrhea, it is generally a milder disease and it is caused by viruses, toxins that affect the small intestine. Okay, above, inflammatory diarrhea affects the large intestine, but this non-inflammatory diarrhea affects the small intestine. It is interfered by salts and water balance, resulting in a large volume watery diarrhea. Here was we have actually small. Basically, it has actually the non-inflammatory diarrhea basically has the large volume watery diarrhea, but the inflammatory has the small volume diarrhea. And the patient in non-inflammatory has the complaint of nausea, vomiting, and cramps, but in inflammatory the patient will complain of the water, fever, and the bloody diarrhea. Now moving towards the food poisoning, which happens to most of the people. When you see, actually it is basically the disease caused by the toxins which is present in the consumed food is called food poisoning. When the incubation period is short, 1 to 6 hours after consumption, the toxin is preformed and present in the contaminated foods, and the vomiting, which is a major complaint, and fever is usually absent in these patients. Examples are toxins which is released by the Staphylococcus, Bacillus cereus, or toxins which is detected in the food. When incubation period is longer than 8 to 16 hours, the organism which is present in the food produces toxins after being ingested. Means when incubation period which is short, so basically the toxins which are preformed, they are present in contaminated food, and vomiting happens. And 8 to 16 hours, when the incubation period is, so the organism is present in the food which produces actually toxins and been ingested. Vomiting is less prominent in the 1 to 6 hours, the vomiting is present, but 8 to 16, the vomiting is less. Abdominal cramps are frequent and fever is often absent in both cases actually. Example, it is caused by Clostridium perfringens. It also causes food poisoning, gastroenteritis, which is the second name of that.